Hey everybody, Vince Burke here on my session 3 for the COVID-19 patient coming home alone, what I call homecoming. And just to remind you that these patients who are coming home, they want to feel connected with family, but guess what? They really can't have that personal connection just because of all the protocols that the CDC comes out with, and also of the movement of not having a lot of family contact. With all the statistics around, especially here in Bergen County, North Jersey, the numbers are higher. So again, family members have to step in just because of the availability of agencies to provide aids to help, and also nurses and physical therapists and so on and so forth. So what I want to do is, this is my third session. This really has to be probably one of the most important, just because it has to do with bed mobility, positioning, and how to get in and out of bed. The other thing that you have to think about is that, when you go to the hospital and you're there for a long time, just from the pathology of COVID or any other pathology, and you happen to come home, you can be in there for a stroke or whatever it may be. It's just your normal pathologies. You're coming home, you still have pain, loss of function, and weakness across the board. But you also have the underlying issues, of the aging population. We have arthritis, painful, stiffness. We also have osteoporosis that we need to think about. So these are all other pathologies that have their own sequelae, meaning effects of them. And from there, now we have compounded issues with the COVID. So what I want to do is, let's just kind of review. We did the seated chair exercises, and then we did the standing, Now, when we're sitting in a chair and we're talking about mobilizing the lungs, and I know we talked a little bit about this, but I want to just go over a good posture, and I want to go over pursed lip breathing. So when we're here up tall, I want you to think about coming in through your nose and out through your mouth. But your lips are lightly touching, but you want to push. So again, you want to go in through your nose and out. Again, put your hand here over your belly. And again, in through the nose. Now sometimes, again, being that this disease it's about the lungs, it's definitely okay. You're in an isolated area, so you need to move your lungs differently than most people, because without the heart and lungs, we're going to be back in the hospital. So we need to exercise the lungs through breathing. But also, a forced cough is okay to do. It's okay to do. You're alone, and you need to do that. That's really important. So even at the end, right? Now you could take your hand like this and and cough. You cough. You don't have to be spewing it all over the place. So that's really important. So and if you're doing that, sitting down and you're just thinking, just relax. Hand over your belly. Very important to do. So how many you do? If you were to do a couple of them an hour, it really engages into your lung mobility and secretion. The important thing is that, remember we talked a little bit about one time, is that if you're hydrating, you're making your lungs kind of slippery, which is good, and you need that for mobility of whatever, all right? So let's go over a couple things. So here you have your bedding, Here's your bed, And again, have to have a lot of pillows around, So if we want to think to have your body on angles like this. So if I'm like this in this position, if I'm like in this position, my angle is this way, and I'm draining my lungs in different positions. if down here, okay, and I'm exaggerating, okay, but if my pelvis, okay, is up in here, okay, my pelvis is up in here, okay, if my pelvis is higher than my heart, then I'm going to get some fluid up in here. This is just simple drainage position, okay? This is important to think about, okay? If we do happen to go on our side, okay, and again, it's the same kind of thing here. You could put a pillow in between your legs here, but again, my pelvis is up higher and I'm getting some fluid coming in this way, okay? So that's really important, all right? So those are just some ideas to think about. Now, what I want to go over is, we have to think about dignity, privacy, and all that stuff. If you have a daughter or son caring for somebody who's frail and not that mobile, we have to think of dignity. The only way we can think about dignity all the way through and through is before an incident happens. That's a plan. Remember we talked about that? You have to have a plan. So let's just assume that when we're going to bed, right, if they do have issues with bowel and bladder, and probably, coming from the hospital, being immobile, that usually happens, okay? So we need to just think that they may have some accidents in bed. So let's think about that. So if they do have to wear, and you're the caregiver as a son or daughter, you need to then think about having them wear a diaper, okay? And then, it's not an easy conversation, but the bottom line is that less contact for you, okay? And they have to think about that too, as understanding this issue that we have, okay? The laissez-faire policy, right? Okay, so now let's just think about these as chucks, okay? So if there is a little bit of a can't get diapers, whatever it is, okay, to have on the bed 2 chucks. If there is actually an accident at night or whatever, okay, this one is wet just for dignity. Oh, I went to the bathroom, whatever it is. At least you could have them bridge and at least slide this one out, and then have another one here that's dry. I mean, that's the best thing that you could do, to have 2 as a backup plan. That's really important, all right? So always think about that, so you're setting up the bed. The other thing is that, having the sheets, okay, and then you have a topper, okay? Think about, you could definitely have that topper so you can remove it the next day, and then you just wash it and put it back on, okay? So that topper is protecting the bed itself. Just from a hygiene perspective, clean and smell, just get that on there, and that's important to do, and that goes right on there, all right? So I think that covers the whole diaper issue. Now, let's think about how we're gonna get into bed, right? Some of the beds, we're lucky we have a hospital bed, okay? And they have the railing, so that's good if they do. But if not, right, we need to think about where the bed is going in isolation. And this is the tricky part. Some people, they don't want to be on stage and have their bed in the middle. So, ideally, it's always good to have access to both sides of the bed, okay? Both sides of the bed. Because if you do, and the beds are on wheels, that's even better. But what happens is, if you're with that person and they need help to go to bed, you're in front of them. And I know as a caregiver, family person, you may not feel comfortable. So it is a lot easier to be from behind them to kind of assist a little bit. The other thing is that when it talks about bed mobility, okay, if they do happen to sit on this, you could actually come behind and pull a little bit. You could pull so that their bodies can come this way. Same thing here, you could be here, okay, and you could actually pull up a little bit, pull. So this helps as an assistant to you, because you're not gonna have 2 or 3 people. But the big thing here is that they need to be in a good position so that you're not hurting your shoulders or your back. So when they're on the bed, and I'm going over this here a little bit, when they're on the bed, okay, and I'm just going to get right to it. If they're on the bed down here, okay, that's a lot of work for you, okay? But if they're on the bed up here, okay, not easy. It's a lot easier. The other thing is that they could actually put their feet here and push, and they could they could actually slide up. They could actually, they're here, they could slide up with their feet pushing to be up. Okay, so that's important. So these sheets you can do, towel helps for sliding your bed mobility. Now, when we think about where we're gonna go with this whole issue of transferred bed mobility, we have to think being efficient. And what that means is that we have to think of energy conservation. If we're making them tax and belabor themselves where they're exerting so much, their anxiety is going to go up, and also your anxiety and stress is going to go up. Our goal is to kind of go in and out, but you want to hurry up, of course, because that's the whole thing here. Not a lot of contact, but you want to be efficient. You want to pace yourself and have a plan. So if I'm over here, we could spend a lot of time on telling what not to do. Forget about it. We're going to say what to do, okay? So you know that if they got to go in, they got to walk up to here, right? And wherever their body and their head is going to land-ish here, that's where you want to park the car. If we're down here, right? Now they got to climb up. So you have to think, okay? Real simple. What you're going to do is a good trick is here's the pillow, okay? This is a landmark. I call it, right? It's like a cone in parking, okay? The other thing is that it's always good. It depends on if they're vertically challenged. You could have a stepper, okay? And that's underneath. So this will help them get up, okay? So we can go here, okay? So what you want to do is the front of the walker, okay, goes here. That lines that up perfectly. And then what you do, we talked about this, right? You back up, right? Okay? Now, have the caregiver pull that out. So now they're here, right? Okay? Because now it makes it easier to step up here. It makes it easier to step up. Okay? Now they're here, okay, and they can sit back. Now, just to be efficient, right? The thing that you want to do is you want to drop your arm down here, and the legs will act as a pendulum a little bit. So the caregiver could actually assist both legs here, both legs, right? Both legs, and they come down, okay, and come down. Okay? And now they're in a good position. They're laying down. They landed one, and you assisted their leg. Now you could help with position. Now, again, we talk about blood clots, right? That's important. And sometimes when they're in bed, if their legs are above their heart on a pillow or whatever, it's like this, they could do ankle pumps, exercise, okay? Because you want to move the calf for circulation, so the elevation is above the heart, so everything is going into the lymphatic system and getting out. So that's important, okay? When we're in bed, so we talk about bed mobility, but you're in here, right? So exercise in the morning is important. So you could actually, in the morning, you're here in this position. You probably don't, it's hard with all these pillows, but the one is fine, okay? And your hands are like this and lifting up bridges. Again, when you're doing bridges, again, you're working on the lung mobility, okay? And again, when you exercise, so I'm lifting up and down. You can hold it there a little bit and bridges, okay? That's important. You could actually do some heel slides, which is good, just good for circulation, both legs, right? You could do some open and closing, range of motion for the hip. You could do some kick-ups like this, okay? You could do some marching. You could do hamstrings more where your heels on your tippy toes, straight leg raises. Okay, so there's a lot of different things you do. the upper body. You can do some stretching, helps open up the rib cage a little bit for breathing. So there's a lot of things that you can do here, but for some simpleness, let's just move on of how we're getting up. So if we think about how to get up, you want to roll to your side, okay, with the caregiver here, okay, and the caregiver's down and they drop the legs down and they're pushing here and lifting up. Now, because the hemodynamics, not to use big words, but whenever we're changing the body to different positions, we sometimes could get disoriented and a little dizzy. It doesn't mean that that's a 911 call or call the doctor, I feel dizzy. Lots of different things going on there. You need to have them settle in. That's why having a step stool is important, because they could hear. As soon as they're down on the ground and now you're up here, they feel connected and they just wait there. They just wait. Breathe. That's it. You know, that's important. Get their senses together. You could talk from a distance. But here, right, we did some other stuff, right? So here you could do, when you're up tall, right, from core stuff, exercises, marching in place. You can do some trunk mobility, side bending, rotation. So there's a lot of things to do. Shoulder shrugs, breathing up in here. So there's a lot of different things. In every position that you're in, you could probably do some simple exercise, all active range of motion for your elbows and so on and so forth. The one thing that we have to think about is that, you know, you probably had some injuries maybe even before, and you need to get back to physical therapy on the outpatient clinic to back to see us. So we want you to be safe coming home, get independent quickly, not have the virus exchange or the germs exchange between family members. Be safe and go from there. So then when we think to get up, right, you're here, okay, and always have everything is all set up. If this was here that night before, right, that's easy. Have your gloves on and you pull it here, okay, and then you can have the chair there. So now this is out of the way. They're on the ground, right, and they're here. Now this is in front of them, okay, just like we would do the chair, and you lean forward and you come up, and then you're set. You have your chair over here to sit, and you have your breakfast area, whatever it may be. So the more you get in and out of bed, in and out of the chair, walk, do your exercises, chair sizes, standing up, bed mobility, think about breathing, and also doing your different lung positions for drainage, doing some coughing, hydrate, good protein nutrition, and communicate with the family as much as possible from afar, but feel that near. I think this will be helpful for everybody about transfers, bed mobility, some things to think about to restore dignity and bring that home. That's important. So hopefully that was a big help for you. So that's lesson 3 on the COVID-19 homecoming. Till next time, Vince Burke, lesson 4 coming up.